Every minute, hundreds of families lose someone. Not in accidents, not in visible emergencies, but at home, in their own bed, with the lights off and the pillow still warm. And the most disturbing part is that in most of these deaths, what fatally compromised the person's health was not a new disease, not something unpredictable. It was a habit, something simple, repeated every night, silently wearing down the heart and the brain, until one night the body simply couldn't take it anymore. Today, I'm going to show you the 7 most dangerous nighttime habits for your heart and brain. Habits proven by science to dramatically increase the risk of heart attack and stroke during sleep. And I'll do it clearly and straight to the point, because the last habit I'll reveal is the most dangerous of all, and you need to hear it. I am Dr. Sebastian Walker, and if you want to keep receiving important health content for people over 60, subscribe to the channel and hit the like button. Here, we talk about what your doctor often doesn't have time to explain during an appointment. But before we get into the habits, you need to understand something that changes everything. At night, your body enters a completely different mode. Blood pressure drops, the heart slows down, stress hormones decrease. This is when your body tries to repair itself. And that's exactly why anything that interferes with this process becomes a major threat. You're not straining your heart when it's active and ready. You're straining it when it's trying to rest. It's like pushing someone down the stairs while they're asleep. The impact is much greater because they weren't prepared to fall. Let's start with habit number 7, the least talked about, but far more dangerous than people realize. Taking sleep medication without a prescription. And many people do this. I know insomnia is torture. I've seen patients spend hours staring at the ceiling, turning side to side, watching the clock hit 2, 3, 4 a.m. It's real suffering. And when they can't take it anymore, they go to a pharmacy, take something a neighbor recommended, or use leftover pills from a spouse or child. It's understandable. But what happens inside your body after taking that pill without medical guidance can be devastating. A study conducted by Dr. Daniel Kripke, a sleep researcher associated with SCPS Health in the United States, followed nearly 35,000 patients over several years. The result was alarming. People who used sleep medications had nearly 4 times higher risk of premature death, including from cardiovascular causes. Why? Because most of these drugs, especially benzodiazepines, depress the respiratory system. Your breathing becomes slower, shallower, weaker during sleep. Imagine your heart as a power plant that needs constant fuel. That fuel is oxygen. Taking these medications without guidance reduces that supply exactly when your system is most vulnerable. The result can be an arrhythmia, a chaotic, disorganized heartbeat. And arrhythmias during sleep are one of the main gateways to sudden cardiac death. Mrs. Irasi, 69 years old, lived alone in São Paulo. After her husband passed away, her sleep went with him. A neighbor gave her a pill left over from her daughter's treatment. She started taking it every day. In the 4th week, her daughter went to visit her and knocked on the door for 20 minutes with no response. She found Mrs. Irasi unconscious, breathing very slowly. At the hospital, they discovered undiagnosed sleep apnea that the medication had worsened to the point of putting her life at serious risk. If you have trouble sleeping, look for a doctor in your city. Never take sleep medication on your own. Habit number 6, going to bed angry or after an argument. Your grandparents used to say, "Don't go to bed angry." Most people think that was just common wisdom, something we hear, smile at, and ignore. But science confirms with alarming data that they were absolutely right. A study published in the Journal of the American Heart Association showed that during an episode of intense anger, blood vessels temporarily lose their ability to dilate. When vessels don't dilate, blood doesn't flow properly, pressure rises, and the risk of clot formation increases dramatically. A study from the University of Sydney, published in the European Heart Journal, found that the risk of a heart attack is 8.5 times higher in the 2 hours following an intense episode of anger. Now imagine taking that anger to bed with you. Cortisol doesn't drop, adrenaline doesn't disappear. The pressure that should be going down stays high. The heart that should be resting remains on alert. It's as if your body spends the entire night preparing for a battle that will never happen. And in that state, any unstable plaque inside an artery can rupture, form a clot, and cause a heart attack or a stroke. In a moment, I'll tell you about habit number 1, the most dangerous of all, and the one most people don't take seriously. But first, let's finish habit number 6. Mr. Louise, 73 years old, retired. He watched the news every night, got angry, argued with his wife, and went to bed irritated. One Monday, after a more heated argument around 3 a.m., his wife woke up to a strange noise. He was trying to speak, but the words wouldn't come out. Hemorrhagic stroke. He survived, but with permanent damage to his speech and the right side of his body. Do not take the battles of your day into your bed. Your heart needs peace to recover at night. Habit number 5. Drinking alcohol before bed. Many people swear that a beer, a glass of wine, or a drink before bed helps them relax. At first, it may seem like it does, but what happens afterward turns that seemingly calm night into a silent cardiovascular storm. A major study by the American Heart Association, analyzing nearly 700,000 adults, showed that excessive alcohol consumption, especially when concentrated in a single occasion, significantly increases the risk of heart disease. And this risk is even higher in women than in men. When you drink before bed, 3 dangerous things happen at the same time. First, blood pressure rises exactly when it should be falling. Second, alcohol destabilizes the heart rhythm, potentially triggering atrial fibrillation. When the upper chambers of the heart start to quiver, it creates perfect conditions for clots to form and travel directly to the brain. Third, alcohol excessively relaxes the throat muscles, worsening sleep apnea. Less oxygen reaches the heart exactly when it needs it most. Mr. Rubens, 59 years old, a businessman, drank 2 or 3 servings of whiskey every night to unwind. Until one night, his wife woke up to snoring that suddenly stopped. She called emergency services. Rubens was in cardiac arrest, 4 days in the ICU. The cardiologist explained that alcohol, combined with undiagnosed sleep apnea, created a combination his heart couldn't handle. If you're going to drink, finish at least 3 hours before going to bed. But what comes next in habit number 4 surprises most people. Habit number 4. Not drinking water before bed. It sounds like the opposite of something harmful, right? But nighttime dehydration is one of the most underestimated cardiovascular and brain risk factors in preventive medicine. You sleep for 6, 7, 8 hours. During that time, your body continues to lose fluids through breathing, sweating, and cellular activity. If you go to bed already low on water, your blood will be significantly thicker during the night. A study published in the Journal of Stroke and Cerebrovascular Diseases, analyzing data from more than 3 million adults, showed that dehydrated people had up to 4 times higher risk of hemorrhagic stroke and nearly double the risk of ischemic stroke compared to those who were well hydrated. Think of your blood like a river. When the river is full, water flows fast and clean. When levels drop, the current slows. Mud appears. Stagnant pools form. Thicker blood forms clots much more easily, and a clot in a coronary artery is a heart attack. In a brain artery, it's a stroke. Researchers from Johns Hopkins University presented data showing that approximately 60% of patients admitted for stroke were dehydrated, with 4 times higher risk of worse outcomes. Mrs. Maria, 69 years old, stopped drinking water at 5 p.m. to avoid waking up at night. It seemed sensible. But at 4 a.m., her daughter heard a noise in the hallway. She found her mother on the floor, struggling to speak. Ischemic stroke. The doctor explained that her blood had become so thick that a clot formed in a brain artery. Mrs. Maria recovered, but never walked without support again. A glass of water before bed could have changed that story. Drink at least 1 glass of water about an hour before going to sleep. Keep a bottle by your bedside. If you wake up during the night, take a sip. Your blood, your heart, and your brain will thank you. But now comes something that may surprise you because habit number 3 is something almost everyone does. Habit number 3. Eating a heavy meal close to bedtime. In many places, this is almost cultural. People get home at night, tired and hungry, prepare a large dinner, eat well, and half an hour later, they're in bed. I understand, life is busy. But what happens in your body during that short interval can come at a high cost. A study presented at the American Heart Association Scientific Sessions, conducted by Dr. Francisco Lopez Jimenez, a cardiologist at Harvard Medical School, showed that a heavy meal can increase the risk of a heart attack by 4 times in the 2 hours that follow. 4 times. Because when you eat a lot, your body needs to redirect a large amount of blood to the digestive system. The heart rate increases, blood pressure rises, and substances are released that make the blood more likely to clot. All of this while your body should be slowing down. It's like turning on all the electrical appliances in your house at the same time using an old circuit breaker. And it's not just the quantity, the timing matters too. A study called Nutrinet Santé, published in Nature Communications, which followed more than 100,000 adults in France over 7 years, showed that people who ate their last meal after 9 p.m. had a significantly higher risk of heart attack and stroke. On the other hand, having dinner earlier was associated with a real reduction in stroke risk. Mrs. Irma, 61 years old, a retired teacher, always had dinner after 10 p.m., waiting for her husband to get home. One night, she woke up with chest pain radiating down her left arm. Cold sweat, tingling. Acute myocardial infarction. 2 emergency stents. The combination of a late, heavy dinner and uncontrolled high blood pressure had been the trigger. Have dinner earlier and lighter. Allow at least 2 to 3 hours between your last meal and going to bed. But what comes next in habits number 2 and 1 is where most people truly go wrong. Before that, one important thing. If you've made it this far, you've probably realized there's information in this video that your doctor may never have explained this clearly. And I have something even more complete to offer you. In the pinned comment below this video, you'll find a link to a medical guide to help prevent heart attacks and strokes. It's a resource with the most important information every adult over 60 should have at their fingertips. This is not an advertisement, it's a practical extension of what we're discussing here. Check it out, because it can make a real difference in your life. Let's continue. Habit number 2. Snoring and doing nothing about it. Snoring may seem harmless. It annoys the person next to you, but most people think it's just due to fatigue or weight. But snoring can be a visible sign of a much more serious problem: obstructive sleep apnea. Sleep apnea happens when the throat muscles relax too much and partially block the airway. The person stops breathing for 10, 20 seconds, sometimes longer, and this can happen dozens, even hundreds of times per night. A study published in the Journal of the American College of Cardiology, following nearly 11,000 people for more than 5 years, showed that sleep apnea significantly increases the risk of sudden cardiac death. The most alarming data: people with severe apnea had a 2.5 times higher risk of sudden death between midnight and 6 a.m., exactly when most people die in their sleep. Imagine a hose with someone stepping on it repeatedly. The water stops, pressure builds, and when it's released, it bursts through uncontrollably. With sleep apnea, it's exactly the same. When the airway closes, the heart goes into emergency mode. It beats harder and blood pressure spikes. When oxygen suddenly returns, it creates oxidative stress on the artery walls. This happens dozens of times per night. Month after month, the arteries become more inflamed, stiffer, and more vulnerable. Mr. Ignazio, 71 years old. His wife complained about his snoring for 10 years. He laughed, said it meant he slept well. until the night she woke up to a silence that scared her more than any noise. He was purple-faced, not breathing. A sleep study revealed severe apnea, more than 45 events per hour, enlarged heart, uncontrolled blood pressure. The doctor was direct. It was only a matter of time. If you snore, see a doctor. Ask for a sleep study. Treatment exists, it's effective, and it can literally save your life. And now we reach habit number 1, the most dangerous of all, the most common, and the one most people not only practice, but are proud of. Habit number 1, chronically sleeping too little and thinking it's normal. In many places, there's a strange culture of glorifying people who sleep less. Someone says they sleep 4 or 5 hours a night as if it's an achievement, as if needing less sleep is a sign of strength. My friend, I need to be very clear with you. Your body is not strong. It's suffering. And this silent suffering will show up as a heart attack or a stroke. A study published in the European Heart Journal involving nearly 500,000 participants showed that people who sleep less than 6 hours per night have a 48% higher risk of developing or dying from heart disease and a 15% higher risk of stroke compared to those who sleep 7 to 8 hours. 48% higher risk just because of sleep. And it's not just about quantity. Quality matters just as much. During deep sleep, blood vessels repair themselves, hormones rebalance, inflammation is controlled, and blood pressure is regulated. When you don't reach deep sleep, when your sleep is fragmented and shallow, this maintenance simply doesn't happen. It's like a car that runs every day and never goes to the mechanic. At first, everything seems fine, but internally the engine is slowly breaking down.